Welcome everybody to another episode of Wellness Warriors. I'm Dr. Veronique Desognier, better known as Dr. V. And today I am so excited to have my friend and colleague, Dr. Tony Jimenez, with me. Dr. Tony has a list of credentials, which I don't need to get into, but he is a medical doctor and a naturopathic doctor. He has 4 clinics, Hope4Cancer in Tijuana, in Cancun, in Bangkok, and in Colombia. Is that right?
That's right. Thank you, Dr. Lee.
Yeah, so welcome, Tony. Thank you so much for taking the time on your busy schedule to be able to share your experience with our audience.
Well, it's always a pleasure, and anytime we could educate, because I know that that's a big part of what you do. What we do is to let people know that there are options there, besides the conventional therapies. And today is actually a very good day that we're doing this because I'm in the Tijuana clinic, south of San Diego, and it's really great. We have 3 visiting doctors and professors from Germany, and so it's really exciting.
And that's one thing that I love about you, Dr. Tony, is that you're always on the cutting edge of technology. I know, I host retreats in the Cancun Hope4Cancer Center, and I bring women there so they can, be exposed to the technologies. And when I was there in November, I had a very interesting test done called the PDIS, Photodynamic Infrared Spectrometry, which basically is a laser that's inserted in a tiny little catheter in the vein, and it reads real-time live circulation of any cancer cells, circulating tumor cells, if there are any. And I was so happy to know that 0 was in my blood. And so that was just a great test. And so I'm really excited about the technology that you bring to your clinic, so that people don't have to travel to Europe. They can come down to Mexico, which isn't that far, and take advantage of these technologies. So let's talk a little bit about your 7 key principles. I know I've got the 7 essentials, and basically your key principles align with that. So let's tell everybody what your key principles are.
Yeah, for some reason we're really good friends and colleagues, right? Because we're like-minded. And just a little plug, and I know you have a book coming out as well, but in a month or so, my first book called Hope4Cancer, the 7 Principles to Remove Fear and Empower Your Healing Journey. So it is about those 7 key principles. And after 25 plus years working in integrative oncology and all over the world, as you mentioned, Dr. V, these 7 key principles are a must not only in the treatment, but also in the prevention of cancer. Those 7 key principles are non-toxic cancer therapies, and that's the only one that for prevention you don't have to do because you don't have cancer, but non-toxic cancer therapy is very important. Also enhancing and modulating the immune system. We know that the immune system protects us from a cold and to cancer and everything in between. So all of us on a daily basis must work on enhancing the immune system. The microbiome, we have heard so much now more recently about the gut microbiome, the brain microbiome, thinking that the microbiome is a system in itself. It's composed of literally like organs in different parts of the body, right? So the gut microbiome and the microbiome systemically is a key principle. And detoxification, that starts from the thoughts, right? I've always been known to say a negative thought can kill us faster than a bad germ. So we have to start detoxing those negative thoughts and traumas and fears. As a patient of mine say, cancer is not the enemy, fear is the enemy.
Absolutely,
right?
Absolutely.
And then another key principle is oxygenation. We know very well from extensive research in cancer that cancer cells don't thrive in a high oxygenated environment. So oxygenation is vitally important in preventing cancer and also in treating cancer. With most of the therapies that we do here, if not all of them, we provide ozone, hyperbaric oxygen therapy, even intravenous oxygen. So there's many modalities, but that's more clinical, improving your oxygenation just by walking, exercising, deep breathing, eating live, healthy foods is simple things that we can do. And you can learn that in both of our books, I'm sure. The other key principle is the aspect of the emotional, spiritual. Where does this fit into oncology and breast cancer? In particular, breast cancer is so linked to traumas in the past and conflicts. We just had a patient from Australia recently, two young girls. I mean, this patient's under 30 years of age, two small children. She had a severe trauma with her husband, who she didn't know this, but he was into drugs and using really heavy drugs to the point that he was living more in the streets than in the house with the family. And it came to a point where the now patient of ours had to tell him that, he wasn't welcome in the house anymore. And so shortly after that, the breast cancer in the right breast. And not only that, it was so traumatic for so long of a time that she was undergoing this trauma that now she had metastasis to the liver, metastasis to the lung. And guess what? The blessing is that once we focus on the emotional trauma and her letting go of this, and for 2 days, our doctor there in Cancun clinic that you know very well, Dr. Leslie Gomez, for the first 2 sessions, the patient was frustrated, she was upset, she was even aggressive towards the doctor, until the doctor had to say, we're here together to help you, and please accept this, because with everything that's happening in your life, if we don't address this, major issue,
right?
And this is what we account to be a big part of her healing. These metastases are going away. Her lung tumor is 75% smaller.
Wow.
Right? And so it's just something that all the patients that come to your retreat in Cancun, that, consult with you, that come to Hope4Cancer, they need to really embrace the emotional, spiritual aspect of healing, because, it's something that most doctors are not going to talk about, right? But very important, and that forms part of the 7 key principles, part of the 7 essentials, and we should not underestimate the empowerment that happens once the patient is able to release that weight from their shoulders, if you may. So
Absolutely.
we talked about non-toxic cancer therapies, immune system, detoxification, oxygenation, the microbiome, the emotional, spiritual, and then there's the one on nutrition that we cannot forget. That's the 7 key principles. None of them are in order of importance because they're all key principles for a reason, right? So the question, I know you had a recent post or podcast or something on nutrition, right? And I'm with you. In this book that's coming out, Hope4Cancer, I coined a term called the Garden Food Plan. And in the Garden Food Plan, I describe a plant-based nutrition regimen. And I don't even want to call it regimen, just a lifestyle. And, there's a lot of things going on now with keto and paleo and this and that. So maybe that's a topic for another time. But nutrition is key, and being consistent with these 7 key principles makes the prognosis more favorable.
Absolutely. So the emotional aspect, healing your emotional wounds, we know is major. I know for me, and especially with my second healing journey, I got sucked into the vortex of wanting to help every single woman out there who had breast cancer. And I was doing a lot of one-on-one coaching, and I didn't set proper boundaries. And I know that was one of the stressors that really got me down that path again. And in emotional healing, it's often the most difficult aspect because it's not tangible, right? We can get real good with our nutrition and our supplements and our coffee enemas and whatever. but we neglect the most important part, which is our heart and our connection, you know, with God and our spirituality. So talk a little bit about the recall therapy, recall healing therapy that you use at Hope4Cancer. I was really amazed when I had my session done, and everybody that we've brought there are like, wow, this is really powerful.
Yeah, and now we're even improving and upgrading the recall healing part of it, because now we're calling it the BEST program, where we're working with the behavioral, the emotional, and the spiritual. And we can't forget about the behavioral, because, you know, when you're consulting a client, a patient, and we're treating one, we have to see what their behavior, what their personality is, right? Because some of them are red. Some of them are more, you know, analytical. They're very blue. Others are yellow type personality. So once we assess this, then we have a better way of intervening with them in helping them go to that recalling of traumas, recalling conflicts in their lives, and then that way we could get to these deep-seated, embedded conflicts. It's often said that, you know, what you don't let go of will be there forever, to be haunting you in a way, and ultimately increasing the risk of developing cancer. So the recall healing is a part of a BEST therapy program, where we are doing a chronological assessment of the patient's life, right? To see what happened when they left home at the age of 18, 20, 31. Some have never left home and they're 33 years old, right? So what's going on with all that? So it's identifying the traumas and the conflicts. And this is why you said that it's not tangible, because this is hard work and it hurts. You know, it hurts to remember that first love that disappointed you, right? It hurts to remember and try to recall all the negative events that happened that led to a divorce, right? Or an abortion, or a death in the family. So it's going to those areas of grief in your life and helping you to really and ultimately letting them go. And once you do that, cancer has no reason to be there, right? Today, I woke up today in sunny San Diego, you know, January 31st, it's like 70 degrees. And I wake up to a message from my staff in Cancun. And it was about a patient that was there just 5 weeks ago with stage 4 non-small cell lung cancer, mets to the liver, and some metastasis in some of the lymph nodes. So this is stage 4, considered by conventional oncologists terminal. And guess what? Now the scans done back home are clear.
Amazing.
And the first thing, Dr. V, the first thing that the doctors in the chat were asking, what was the emotional conflict with her? You know, before they even asked what was the therapies that we did, you know, was it Sonophoto or was it Marigen or whatever, it was about the emotional. Because within our group, we have over 25 doctors in both of our clinics in Mexico, you know, combined. And that was the first question they asked, because we've learned throughout the years that the emotional spiritual is, you know, on the top of the totem pole.
It is so, and I think the more we learn about cancer and healing the body, I think the more we recognize how important that is, you know, from the energetic, emotional plane. And you mentioned with BEST, the behavior, and you mentioned colors. Do you use color profile?
Yes, we're starting to do that. We're blessed that we have a person on our staff now who's worked for one top 100 Fortune companies in the world, and she is developing this program with us, and it's amazing what it could do.
So what color are you?
What do you think?
I'm a red or a blue?
Yeah, I'm actually blue and green.
Oh, okay. Okay. I don't know about the green.
Yeah.
I'm a blue and
You're
a white.
blue.
Yeah, blue and a white.
Yeah, so.
Interesting. Okay. I like, because I just did the color profile just a few weeks ago. I found it very fascinating.
It is.
Now, when patients find out about your clinic, I know there's concern, oh, Mexico, and is it, I've had women ask me, how do we know it's legit? And, and I'm sure you get plenty of those types of responses or questions. And what I really loved about my first visit there was just like, I knew it would be beautiful anyway, but, the clinic is just, it's like it's a 5-star facility, and everything is run so smoothly, and it's organized, and your team, yeah, your team is just amazing. I mean, they're all so loving, and that's what I one of the things that I really appreciated, how loving and concerned, because they realize that people that go there are very, very sick. And sometimes they're not always friendly, like you said, right? Because they're just going through so much emotional turmoil. So, so when people want to find out more about your clinic in general, I mean, obviously they can come with me if they're part of our community, but if they just have different types of cancers, and what's the process if they want to find out more about your clinic?
The part of the first question that you asked is so important because, Mexico, right? And the news, as you know, especially now, we're in January 31st, 2019, and they hear about the wall and they hear about the migrants and all this. But I mean, the window is right here to my left. The beach is right in front of me. I'm in Tijuana, Mexico. We've been here at this clinic for 18 years. And wow, this is nice. Patients are walking on the boardwalk. I could see San Diego down yonder here, and it's fine. Some people think that when they come to Mexico, they're going to find someone in the corner with the Mexican sombrero and, a rifle or something like that. No, not at all. This is Tijuana, Mexico. It's safe. Patients arrive in San Diego. It's a 30-minute drive from the San Diego airport to the clinic. We take care, as you know, of all that. You've been mostly to our Cancun clinic, Dr. V. And, Cancun, I was just in Asia a couple of weeks, in Japan and in Thailand. I came back a week ago. And when I mentioned Cancun, everyone knows about Cancun. And they say, when can we go? Doctors and, scientists, when can we go to Cancun, right? So Cancun is just beautiful. It's paradise. I applied for the job in Cancun, but I didn't get it. So, but anyway, I get to go there and see you every so often. So I'm blessed. And the process is basically go to our website, Hope4Cancer.com, Hope4Cancer.com. It's very interactive. It's not a website that's going to bore you. At least we try to make it that way. There's a lot of short educational videos, 5-10-minute roundtable videos, a gallery, very friendly. And above all, to know that when you come to Hope for Cancer, whether it's the Tijuana clinic, the Cancun clinic, and now the clinic that we have in Thailand for those patients from Asia, Australia, New Zealand, that it's easier for them to get there. The core principles, as you mentioned, Dr. V, alluded to, is hope, faith, love, and generosity. And by instilling that in our group, that's so important to get the outcomes, because when patients come to us, and because this happens to you as well, they failed other therapies, they're in late stage 3 or late stage 4. And so, they don't have love. Sometimes they don't even love themselves. They don't have faith in that they could heal for the most part, right? Mm-hmm. And generosity, well, they are at a time now that they need to be receiving, right? And the hope should never ever go away, because as the 2 examples I said today with the non-small cell lung cancer, the patient in Australia with advanced breast cancer, these are real patients that are getting better and they're healing. And so I just encourage all the viewers to check out what Dr. V is doing, what we're doing together with Dr. V, what we do at Hope for Cancer. And we're here for you. We're here to answer your questions. And every day we're getting better, because we know, Dr. V, that, cancer is not the same now that it was 20, 15 years ago when we started in this journey of helping people, right? In those days, it was nutrition, B17 and maybe some coffee enemas, and many people were getting better. Now it's so much more complicated because of all the factors we know, right? All the epigenetic things that are happening with Wi-Fi, smart meters, and the list goes on and on.
Right, right. And we know more about cancer. So, I tell our audience, we know what cancer is and what cancer is not. So that really has helped us. And yeah, we're light years ahead of understanding how we can reverse,
Right.
this disease in our body. So one of the treatments that I got to experience with one of our clients that was there had to do with lasers being inserted in the tumor. And can you tell us a little bit about that type of treatment and what it is?
Yes, this is photodynamic therapy, photo meaning light, and it's dynamic because it's in real time. So what we're doing is we're giving a substance that's non-toxic, either intravenously, under the tongue, or topically, or a combination of them. We wait X amount of time for that substance to selectively bind or be absorbed by cancer cells.
So just cancer cells, not healthy cells.
Just cancer cells. Why? Because cancer cells have a different endothelial wall. That's the wall, the membrane of the cancer cell is totally different than a normal cell. So cancer cells gobble these sensitizers, we call them, very quickly. Normal cells don't absorb them. Even if they did, they're non-toxic, so nothing is going to happen to the normal cell. And then we wake these substances up, as you will. We call them activation, photo activation. And this is in the literature. This is not, really something that Dr. Tony developed. I've been working in photodynamic therapy for over 20 years. So we've enhanced it and we've worked with colleagues throughout the world. And then after we activate it, we wake up the substance that's given intravenously, sublingually, or topically on the tumor. Then we use lights. Phototherapy, lasers, as you mentioned, Dr. V, can be given intravenously. And this is a great innovation because light given intravenously, the photons of this light will go throughout the body and target those areas of tumors that absorb that substance. And that causes what's called apoptosis or tumor cell death. And we could use infrared, which has a deep penetrating light, also topically. So we could use the lasers externally, intravenously as well. We could do it in the mouth. And now a big innovation is in bladder cancer patients, in rectal cancer patients, we could put a catheter, minimally invasive, directly into the bladder where the tumor is, or the rectum, and target the light specifically there. For breast cancer is a lot simpler, as you know, because the breast is external. Mm-hmm. So we put the substance directly into the breast and the lights also with a very thin butterfly type needle directly into the tumor. So it's an array of rainbow color lasers, red, yellow, green, blue, infrared, and ultraviolet laser lights, and very specialized treatment. We're very excited about this, and always in combination with all the other 7 essentials or 7 key principles.
I was amazed when I saw the ultrasound of before and after using that treatment. I mean, the tumor was dead. It was gone. It's fascinating. And that's just one of the types of tools and technologies that are available to you. And that's why, I'm so excited and so passionate about telling people, never fear. I say breast cancer because that's my specialty, but never fear cancer again. You don't have to fear it because there is so much that you could do to be proactive, to heal your body. It's, it's not like it used to be 20, 50 years ago.
Absolutely, absolutely. We have so many tools. We know a lot more. We know that these cancer cells are communicating. We know that these cancer cells are building blood supply, but now we know how to address those features or characteristics of cancer and cancer development, cancer progression, cancer metastasis. There's so much more information. And now I'm happy to tell you, Dr. V, and the audience that are listening and watching, that we now have an upgraded substance, sensitizer we call them, Icg Nano, that has even a profound uh, benefit in greater absorption into the tumor. So we're really excited about that.
Because it's nano, it's microparticles versus liposomal, which was small before, but this is even smaller, so better absorption.
Exactly. And as you said, we're always in the process of development, different tools and technology. The other great news now is that we have a shark spleen extract. Remember, sharks don't get cancer.
Right.
And the spleen is a lymphatic immune organ. So what, together with an FDA GMP approved labs in San Diego, we were able to make a substance that is, well, it's from the spleen of the shark, and it has tremendous effects on the terrain. We know about the terrain, right? The space in between the cells, right? The extracellular matrix. So what this is happening, we call it TCM, T-cell modulation therapy. And what this is doing, it's cleaning up that terrain, enhancing circulation, enhancing oxygenation, enhancing nutritional uptake. So things that cancer cells don't like is what we're achieving with this. And in the very near future, we will see, and we're ready to put out some publications soon.
That's awesome. What's the name of that product?
TCM.
TCM. Okay. No, I wasn't aware of that one. That's a new one. I know you had just come out with Salgina,
right?
Which was more of an immune modulator and stimulator, right?
So we're combining this TCM with the Salgina, and it's interesting. The doctor scientist that developed the TCM has 6 PhDs.
Oh my goodness!
Wow, I had an interesting 2 hours with him, and I needed more time.
I bet.
Yes.
Amazing. TCM. Okay, I'm definitely going to look into that when I go in a couple of weeks.
Yes.
Now tell us where we can order your book, because it's coming out in a few weeks. Can we pre-order or?
Yeah, I think we're still in, we still need to release that information.
Okay.
Yeah, so I'm not sure yet, but of course it'll be on Amazon, to the Cancer website, also.
Okay. Okay.
The website as well. We'll see, right?
Okay. Okay, good. So it'll be on Amazon. That'll be easy.
Yes.
So if there's parting words of wisdom that you would give to women who are faced with a breast cancer diagnosis, what would those words be?
Well, the first thing would be to take a deep breath, right? And know that this is a challenge in your journey. And this is there to, and I'm not belittling a tumor or anything, but this is there for us to do a retrospective analysis of why this occurred. Because a breast tumor, a cancer of the breast, is not an accident. It's not bad luck. It's not something that you deserved. You're meant to be healthy, you're meant to be happy, and you're meant to be well. So let's look at why this tumor occurred from an emotional, spiritual, toxicity perspective, nutritional perspective, and no one better than Dr. V to assist you in this process. And when needed, to form an integration with Hope4Cancer, with myself as the Chief Medical Officer, Medical Director of the Hope4Cancer Group. And so don't be afraid, don't fear, take a deep breath and know that no matter if you were in stage 1 to stage 4, the outcome can be favorable. But you need to be certain about that. You can't doubt, because doubt causes, negative things to happen. And I tell you that from experience, over 25 plus years doing this, and many years knowing Dr. V and her work, and listening to her talk at conferences and, interact with patients. You're in great hands, and just be confident that you could do it. And together as a team, it's always better.
That's right. Creating that community and creating a healing team, because that's what you need with this kind of situation. So thank you so much for taking the time, Dr. Tony, and I really appreciate everything that you're doing. I'll see you in a couple of weeks in Cancun.
All right. Thank you, Dr. V. And we'll see you soon in sunny Cancun.
That's right. Thank
Blessings to
you.
you and to all those that see this podcast and get this information, and never hesitate in reaching out to us. We're here for you. Dr. V is here for you. We're here for you, and take that first step.
Thank you. Thanks for your time, Tony.
Thank
Bye-bye.
you.